Ready.
Okay.
Go.
Hello and welcome to the Community Voice. I'm Fara Sax. I'm so excited today because I have with me Dr. Stacy Nassau. She is a specialist board certified in allergy and immunology with Florida Center for Allergy and Asthma Care. Right here, they have 10 locations in Miami-Dade, and I am so privileged to have you with me.
Thank you. Thank you for having me. This is very exciting.
So how did you become an allergist? Like, did you wake up one morning in third grade and go, I just really like knowing about allergies, food sensitivities, food intolerance. I have hives. I mean, how does that, everybody has their journey. And in this episode of, To Your Health, I love to know about the background, how it all began.
So it's a good question. And it all started actually when I was very young because I had a lot of allergies and asthma myself. So I had an allergist growing up. I have food allergies and asthma. And, I suffered a lot until I found my allergist, who was a wonderful doctor. He took great care of me, my family, my brother, my mom. And I just was very interested in science always. I love to be around people. So when I was in college and kind of figuring out what I wanted to do with my life, I sort of gravitated towards medicine. And then after that, you have to decide which realm of medicine you're going to go into. And I had personal experience in allergies and asthma, and I wanted to help other people that suffered the way that I did.
So, and it's very interesting because I love your whole practice. I have a fond affinity because it began in 1974.
Yes.
And at that time it was Dr. Michael Passon and Dr. Joan Gluck. And they got me through a lot of hurdles and very much inspiration of how to deal with wellness and health. And because I too suffer from allergies and asthma and sinus problems.
Right.
And we'll get into all of that and how we patter along and get well and whole again.
Yes.
So at what age did you say, okay, this is it?
I think I was in high school, actually, that I decided I wanted to be a doctor. So when I was looking for colleges, I looked for a good science program, and I ended up going to the University of California in San Diego.
And you grew up there?
I did. I grew up in California.
Not too bad. What a beautiful...
It was nice.
Yeah, you could say, right?
Yes, the weather was beautiful. Los Angeles, San Diego. I'm actually kind of surprised that I did well in school because the weather and the beach was nearby. But it was a wonderful school for science, and there were a lot of pre-med students, and it was great. I was able to kind of cultivate my interest, and I had a lot of good experiences there. And but it was before college that I had decided this is what I wanted to do.
It's really noble because most people, we scatter around in college trying to figure out how this is going to happen, and opportunity sometimes just presents itself and we fly with that.
Yeah.
So you're in California.
Yes.
And you grew up there and you're trained there, and from there you went to New York.
I did. Yes. So I went to SUNY Downstate, which is a state school in Brooklyn, New York. The reason I went there is I really wanted a big city in seasons. So I just wanted a different life from what I had lived. I was 24 years in Southern California, so it was kind of fun to mix it up and go somewhere with big city, public transportation, and just a different population, people that I had never met before, different walks of life that I had never encountered. And it was really great. It was a wonderful experience. I stayed in New York for my training. I did my residency in pediatrics in the Bronx. And then I did my fellowship training at NYU Winthrop School of Medicine. So that was great.
Wonderful. And so from there, you came to
Florida, to Miami.
November 2020?
I moved in July and I started here in November of 2020.
So this was in the height of the pandemic and the COVID, blah, blah, blah,
yes.
blah, blah.
Yes. Well, it was very, in July of 2020, COVID was very bad in Miami. Yes. So it was, there were 4 people on my airplane when we came down from New York. It was very interesting. It was a strange time. It was a scary time. We still didn't know that much about COVID. We were just starting to see how, deadly it could be for certain people. We had no vaccines, and people were very fearful. So it wasn't a great time to move, but I had finished my fellowship. My husband had got a new position down here, and and we made the move.
And you have 2 kids.
I do. Yes.
And how do you balance that? It's a very interesting proposition to work, to have a business, to be a doctor, and then have children.
It's a lot, but I love it. I mean, my two callings in life are truly to be a doctor and a mother. So, I love going to work. I love seeing my patients. It really brings me great joy. And then at the end of the day, I come home to my children, and they are happy to see me. I'm happy to see them, and it's hard, and it's not for the faint of heart, but I love it, and I'm happy to be able to have the opportunity to do both.
And both. And you work in which location in Miami?
So I have 3. I work in Miami Beach. I work in Kendall on Sunset, and in Palmetto Bay. So in the south part of Miami, I guess.
So there's 10 offices in Miami-Dade.
Yes.
There's 3 in Palm Beach,
Yes.
and there are 6 in Broward.
Yes.
Wow, that's a lot of offices to be
biggest,
like a leading allergist in this county.
Yes.
Counties, I should say.
Yes. Well, it's the biggest in South Florida, the biggest practice in South Florida. So that's very exciting. I'm very happy to be part of it.
So when you had allergies in Los Angeles, and then you had allergies possibly in New York, did you, and like, how does one navigate? Does it have to do with where you are? Like, do you have to be there for a year, and all of a sudden you say, oh my gosh, the pollens, my asthma, my allergies?
That's a great question, because the pollens and the plants are different in different parts of the country, right? So the trees that may be populous in Los Angeles are different than what's here in Miami versus what's up in New York. So in general, it takes a couple of years to become sensitized to the local pollens. So if somebody just moved here from somewhere else, it's unlikely that they're going to have allergies to certain pollens that are local only to that area. A couple of years, 2, 3, 4 years, and then they might start to notice symptoms again. So it's a great question, because when I moved to New York, I felt great.
I know. It's like, whoa. When I lived out in Albuquerque, New Mexico, the first year, I was like, wow, I don't feel this anymore. And then it
came back. Yes. So the ragweed is much more prominent up in New York. So then over time, I started to notice in the fall that I was having more allergy symptoms again. So, but it is very interesting. Depends on where you live, what you might be allergic to.
Absolutely. So it's very, very regional.
Yes.
So the big question I found was, during COVID, I got COVID and I was vaccinated, but I got COVID. But subsequently, even before, I was like, is this a cold? Is this my sinus problem? Is this COVID?
Yes.
Is this allergy? I mean, how does one differentiate for what's happening where we are now, so that we're not always in that state of fear, or just to know what to look for each of them? Maybe you can address that.
Sure. It definitely is confusing. I will say that. So there's a lot of overlap. There's a lot of gray area. So you may have nasal congestion, stuffy nose with allergies, but you can also have that with COVID. So some of the things that would ring a bell more for me, and more red flags, I would say, are fever, body aches. Those are things that you really shouldn't get with allergies. So even if you feel pretty terrible with allergies, you really should never have fever or body aches. Persistent cough is also associated with COVID. Loss of taste and sense of smell is more associated with the earlier versions of COVID, the Omicron less so, but still could be present. Those are little red flags, and I would get testing. And the good news is that now we have a lot of testing. There's a lot of available testing, and it's very easy. And actually the tests are fairly reliable. So you can do at-home tests. You can go here. There's a lot of, Miami-Dade has a lot of testing locations that are free. So I think people should use that to their advantage, because unlike 2 years ago when we really didn't have that. And that was even more of a question, like, oh my gosh, I can't even get tested. I don't know. Now we do have that answer, right?
Yeah, 100%. And it's quick and easy.
Yes.
Yeah.
Yes.
And what I've also found is the younger kids that have been home from school or have been sequestered for the last couple of years, is their immune system like less because we don't go out, the kids don't go out and play in the dirt. They don't have
Right.
their running nose all over their friends.
Right.
They're not sneezing in their faces, coughing.
Right.
Are you finding that uptick is happening now?
Yes.
Colds, flus, because they
Yes.
haven't been exposed.
Yes. So it is the natural progress of life to meet with infections, viruses, and the immune system fights it off. For children, particularly in daycare, their viruses are passed around from one child to the next pretty much every month. So, a parent that just starts their child in daycare will see that their kid is really getting a lot of infections.
And so are the parents.
Yeah. And the parents too. Lucky for us, right?
I'm just going to wipe it on my sleeve.
Yes. It's very unfortunate, but I guess par for the course, right? But a lot of kids have not been in daycare, or they're wearing masks in daycare, which a lot of parents will tell you that they've seen a lot of less infections in their kids than before. So it's not really that the immune system is not functioning as well. It's just it hasn't been given the opportunity to fight off all these viruses. And it is actually kind of important to get viruses when you're young, because it does build your immunity for the future. So when you send your child off to elementary school, they've already met with a lot of those viruses before. And if they get sick again, their immune system has already seen it. They say, oh, I know this virus. I know what to do. They mobilize the immune troops, so to say, and the infection is never really noticeable. So a lot of kids that are now returning to school, the masks are coming off. They're getting sick again. And it's just a little bit delayed. They would have had it over the last 2 years, and now it's coming to the surface again.
So what can one do prophylactically to not inundate their poor little bodies with upper respiratory or cold stuff? And what can we do before we have to come visit you to maybe keep ourselves well and healthy as ourselves and our families? Right.
That's a really good question, and a question I get a lot. So the most important thing is to get good sleep and to get nutrition from a healthful diet. So eating well, sleeping well, and exercising. So for children, that would mean running around, playing sports, things like that. And adults to keep active. That really is the best thing you can do to boost your immune system. I wish there was a vitamin or something that would really be a magic pill that would help everyone stay safe from all of these viruses. But unfortunately, there's really nothing like that. It's just keeping your body in top form is the best way.
And what do you feel about lavaging when you do those nasal rinses where, where you put that saline in there and just irrigate?
I actually love those because it's a non-medical management. And essentially what it's doing is it's cleaning the nose of any debris that comes inside. So whether that's allergens, viruses, mucus that gets caught up in there, washing out the nose with a saline lavage is really an excellent thing to do. And it's very safe, no medicine involved.
And when would someone come to see you? Why would I need to go see an allergist or an immunologist?
Sure. So if you have allergy symptoms, if you have sneezing, nasal congestion, runny nose, anything like that, and it seems to be on a seasonal basis, right? So every springtime you notice it, every fall you are noticing the symptoms, or if it's year round, it could be something like an animal that you have in your home, a cat or a dog, or even dust that you're allergic to. Those are the kinds of things that you really should see an allergist for, because we are specialized to diagnose and treat these allergies, these medical problems. So, so
you do allergy testing and you do immunotherapy. So maybe we can talk about that. How does that work? Like,
sure,
you get little bumps all over your little arm, and you
prick
my arm, and then you see what bubbles up. How does that work?
Pretty much, yeah. I mean, essentially, we take your forearm and we scratch it with allergens. So the common allergens of the area. So we have trees that are and plants that are endemic to Miami that we test for. We have dust mites, which are very common, cats, dogs, cockroaches, all that are common allergies. So we scratch them into the arm and we wait for about 15 minutes. We see if there's any hive that develops in the area. And if so, then that suggests that you have an allergy to that thing. And immunotherapy, which you asked about, is a wonderful treatment. Again, it's actually not medicine. It's a very natural approach to treating allergies.
What is it? What is in those little vials that they shoot in?
Yes. So, great question. It's actually everything that you tested positive to. So let's say you had allergy testing, right?
Who knew? I did.
Yes. Okay. Well, so you're familiar with this.
I'm just a real trooper.
Yes, you are. It's not painful, but it's itchy, right? It's an unpleasant test, but it's not painful, and
Not
it's
at all.
very
But it is good because you find out what's going on.
exactly, and you find out quickly, so you don't have to wait for your labs to come back and wait to talk to the doctor. You find out in your visit, and then at the end of the visit, the doctor will come back and tell you exactly what you're allergic to. So I think it's wonderful.
So you treat children and you
yes.
treat adults.
Yes.
And is it a different way of treating? I know children might be a little bit scared. So how is that dealt with? Because it's an emotional thing for little kids.
So for children, we often do it on the back because it does get very itchy, and we don't want them to scratch away at the test and smear or see it. Of course, of course. So we do it on the back. Usually they're holding their mom or their dad. They're sitting on the lap, and we, just quickly, our nurses are so good at this because we do this all the time. They're truly experts, and children that are fearful afterwards usually say, oh, okay, that really wasn't so bad.
Right. And so once you figure out the formula,
yes,
a patient comes in once a week, once every 2 weeks, and then
yes.
So how does that pattern happen?
So let me explain a little bit about immunotherapy. So essentially we take everything that you're allergic to. So let's say you're allergic to dust and cats.
Who knew? Right? How did you know?
Well, I scratched your arm. So let's say you're allergic to those things. We'll put those proteins into some serum for you. So everyone gets their own serum made specifically for them and what they're allergic to. And we start off very low. We start off with a very tiny amount of the protein. And every week we inject a little bit more. Now, the reason for doing it slowly and every week is we're slowly trying to induce your body to tolerate these things that you are allergic to. Okay. If we start off with a high dose, we're giving you something you're allergic to, and you might have an allergic reaction.
And what kind of allergic reaction might one have?
So you can get a big, local reaction at the site of the injection.
So it becomes red and itchy or bubbly.
Yes. Like a big red hive kind of at the location.
But you watch patients afterwards. You have to hang out for a little while and just like look at each other. And,
hopefully they'll have a magazine or a phone. Hopefully they brought their phone. Nowadays, most people have, so that's nice.
So you just wait in the room when you have a nurse nearby, just in case you have experienced this.
Of course, because the risk of an allergic reaction is highest within the 30 minutes. Sorry, I have something in my eye.
Having an allergic reaction?
No, I think not. Maybe. I hope not. But the 30 minutes after is when you're most likely to have an allergic reaction. So if you do have one, then we know exactly what to do. We can treat you. We can give you epinephrine if it's a serious reaction. We can give you Benadryl, Zyrtec, and it's always nice to have the doctor lay eyes on you if you have anything. So we do advise patients to wait for 30 minutes after the shots.
Got it. And then also you do pulmonology, lung function. What's that about? Like for asthmatics, I would imagine, to see how they are. Because I know they put a little thing on your finger and they go, 99, you're doing really good.
Yes. Well, so that's the easy part, right? So we look to see the oxygenation, that's 99. And then we do lung function testing, which is you blow into this machine, which it's a little bit difficult, but it can be done for children as young as 5. So you can figure it out. But essentially, I'm trying to see how your lungs, the volume of your lungs is looking, and that can help me diagnose asthma. Asthma is a very, very broad diagnosis. So there can be allergic asthma, there can be non-allergic.
There's like exercise induced. I know when I laugh too much, I start wheezing and I start itching under my so my kids always know that they've really pushed it too far.
When you're wheezing.
Yeah, when I'm wheezing. Mom's doing it again.
Yes. Oh dear.
So basically you're finding out how the lung is doing under whatever distress or stress is happening.
Correct. Yeah. So at baseline, we'll get a lung test. And if they're new to me, then I might, if the patient is new to me, then I might give them albuterol, which helps to open up the lungs and see if there's any difference.
So it's beautiful. It's
so beautiful.
It is. It helps. It's an inhaler.
Yes.
Okay.
Yes. It can also be a nebulizer too.
So nebulizer that you put into the wall and you breathe into it. And it has like all the smoke and you pretend like you're smoking a cigar or something.
Pretty much, but it's a little bit healthier than that. So we will give people albuterol and then recheck the lung function after that. So about 15 minutes later, and we'll see, is there a big improvement? If there is, that does suggest an element of asthma. there's no one test that will diagnose asthma. So you need the history of the patient, when do they get the wheezing, shortness of breath,
Right.
What the triggers are. And then of course the pulmonary function test will help us with that too.
And it's a very tricky, like you said, it's a very tricky disease because there's so many factors that go into it that it's hard to know. Is it like you said, food allergy? Is it induced by stress or
exercise?
And if needed be, there are other medications that you give?
Sure. So we actually have a lot of medications. This is sort of an exciting time as an allergist because there's a lot of new medications, biologics that have come out in the last.
What is a biologic?
So a biologic is a different kind of a medication. They tend to be injections, and they act on the inflammatory cascades that cause asthma. So the traditional allergy medicines are inhalers, right? So things that we use on a daily basis. They decrease inflammation in the lungs. So they're often steroids, right? So the steroids will decrease inflammation in the lungs, but the inflammation is already there. With the biologics, we take that inflammation before it really gets to the lungs. So we go a couple of steps back to help prevent it from getting to the lungs and causing that inflammation there. So depending on the patient's history, their allergic triggers, there are about 5 or 6 different biologics that we can use now for the treatment of asthma. So
that's wonderful. What an evolution.
It's very exciting, especially for us, because we can see we see it day to day, how these patients are doing so much better now that they're on some of these medications.
And is there, when you're the inflammation marker, if one has asthma, do they also have inflammation in other parts of their body? Is that something that's been studied, or one has nothing whatsoever to do with the other?
It's a good question. And in general, the answer is yes. So the inflammation, if it's an allergic type of asthma, is an allergic type of inflammation in the lungs. And people with allergic asthma are more likely to have eczema, food allergy, allergic rhinitis, which is the typical hay fever seasonal allergy sort of symptoms. So the genes are generally inherited together. So if you have one, you're not 100% going to have one of those other things, but you're more likely to. So you likely will have allergic inflammation in other parts of the body.
Do you also administer blood tests? Is there a blood test that can figure out what's going on in all of these?
Sure. So we do prefer allergy testing in the office because we can get those results same day, same appointment, discuss it on the spot, and come up with a treatment plan. In some instances, we do blood work as well. So there is blood work that can detect allergies, can look at how many eosinophils or the total IgE of a patient.
What's an IgE?
IgE is a protein that the higher it is, the more likely it is that a person has allergies. So when we're looking at all of the allergies, we actually are sending IgE to each of those specific allergens. So if I were checking your environmental allergies, it would be a dust mite IgE, for example. So we can do all of that with blood. And some people that cannot come off of antihistamines for whatever reason, if they really need to be on them, those kinds of patients, we will do blood work. Or some people have dermatographia, which is a skin disorder, I suppose, where when you scratch the skin, it turns into a hive. So any pressure on the skin will cause a hive. So as you can imagine, doing the scratch testing for allergens is a little bit complicated if everything shows up positive, right? So if somebody has dermatographia, you're doing the skin testing and it looks like they're allergic to everything that you've tested, you have to kind of think that maybe there's something else there, because most people are not allergic to everything that we test for, because we test for a lot of things.
Absolutely. And is allergies and asthma something that's sent to our next generation? Is it our kids? Is our grandkids? Or it's from our foremothers, fathers? Is that how that happens? Or is it just independent?
So that's a really good question, because the
genes full of them today.
You are. I love them. This is great. I love it.
I really do. You can interview me next time. No, I'm just kidding.
Perfect. Well, I don't know if I'll have as good of questions as you, but I'll try. But yes, the genes are inherited from your parents. So if your parents have allergies or asthma or eczema, you will be more likely to have those things. Now, that's not to say that somebody has to have parents with allergies. Certainly allergies can pop up in people that have no family history of allergies, but in general, it is passed down with the generations. Now, in that same vein, food allergy is much more common now than it was in the past.
Why is that?
So there are a lot of theories on why this is happening. And one of the theories is that we're much more clean these days. So there have been studies that show that children that are raised on farms, so they have a lot more bacterial exposure, a lot more dirt.
Oh, so they get down and dirty and they get under their fingernails kind of thing?
Yes. So their life is in general just less sterile than the urban life that we lead here. Those children are much less likely to have allergies and asthma.
Why is that? Because they've been playing with the manure? Is that what happens?
The thought is that there's something that happens with their immune system early in life. I mean, we don't. The bottom line is we don't know, and we don't have an answer. But it has been seen that those children have much less of allergic disease than children that live in cities, and even children that are rural that live not far from children that are in cities. So the actual location is pretty similar, but just the environment that they grow up in is dramatically different. And that shows that, there's a lot at play here, right? There's genetics at play, there's environment. But I don't know if you remember from your childhood, do you recall any children with peanut allergy?
Well, look at her. She's interviewing
Yes,
me.
yeah, I have questions too.
Yeah, no. It's maybe they did, but we're not aware of it, or we know too much now.
Right.
But I don't remember anybody going anaphylactic while having a peanut butter and jelly sandwich on Wonder Bread in New York City. I don't remember that.
No. And I find that a lot. People don't remember that from the past, but now I'm sure you have grandkids, I know. I'm sure that they have friends that do have peanut and nut allergies. And a lot of schools these days are peanut and nut free, which I think is a good idea. But the true rates of food allergy really are increasing in the last 20 years that we've seen.
Is it because the food is more processed too?
I don't think so. We don't really know why. And there's a lot of research going into this. And there's been a lot of longitudinal studies as well. So studies that have began in the 1990s and are continuing now to follow children into adulthood and to, capture these newborns even before they have allergy. Absolutely. And follow them over time and see how many develop allergy, how many develop food allergy. But certainly allergies are more prominent than they once were. So we are needed.
Thank God you're here. I mean, with 19 locations, it's somewhere for someone wherever they need to be.
Yes.
I just want to take a moment. This month's Inspire Health magazine, one of our products at Community Newspapers, the doctor has penned a beautiful article, and it's about food allergies, myths, truths, and facts. And you can see everything on our website, and you can pick up a copy at your wherever you peruse throughout the city of Miami-Dade. So thank you for just wanted to give you that quick plug.
Oh, thank you.
So getting on to food allergies, what's the difference between food allergies, food sensitivity? Do I have not colic? When you're allergic to wheat. Celiac.
Celiac disease. Yes. So great question. Again, so many good questions.
Mm-hmm.
So food allergy is actually an immunologic response to a food protein. So every time that you eat that food, you're going to have a reaction. So if somebody has a peanut allergy, one day it's not going to be this way that one day you can eat it and the next day you can't. Every time that you eat that peanut, you will have an immune response. Okay. And the reaction tends to occur right after consumption.
And it's only minutes. It's not like 20 minutes, an hour later.
It's possible, but in general, it's mostly right after you eat it. So a person will tell you, some people will eat something that they didn't know had their food allergy in it. And they'll say, oh dear, like my mouth, I can feel tingling. I can feel my throat is swelling. And they will know that there's something that was in there that they were allergic to. So it's a lot of people will come and say, I'm curious what food allergies I have, which is a valid question. But if you've never had a reaction to a food and you've never, you've eaten shellfish and peanuts and tree nuts and never had a problem, then you don't have an allergy to them.
So if I got tested for, let's just say, shellfish.
Yes.
Okay. And it shows positive.
Yes.
But I don't feel it. Is that a possibility that happens as well?
Yes. And actually that happens all the time.
So am I allergic to it or not allergic to it?
So you are not allergic to it. So the most important test of any allergy test for food allergy is to eat the food. If you have a reaction, you're allergic. If you don't, you're not allergic. So no matter what the skin testing tells you, the skin testing is meant to support a history of a reaction. So if you had a couple of foods and you didn't really know what it was, and you had shrimp, but you also had, a peanut in there, it can help you delineate what exactly caused that. But in the absence of a history of reaction, the food skin testing is actually not that helpful. And there are a lot of false positives. Food allergy testing is actually notorious for the amount of false positives that we get. So we try to limit the testing to people that actually have had reactions in the past.
So if I ate a whole cake today,
yes, I support it. Sounds yummy.
The only reaction I have is going on the scale the next day.
Yes.
Okay.
Yes.
So that being said, is if I am allergic to something,
yes,
and I feel like this anaphylactic, what kind of symptoms do you have? Like hives?
Yes. So you can have hives. You can have swelling of the throat, of the lips, of the tongue, wheezing. You might have a rash on other parts of your body, even not around your mouth, vomiting, abdominal pain. You might feel lightheaded. But these are all developing right after the ingestion of food. So if somebody says, oh, I felt these things, but it was 4 hours after I ate, it must have been something else.
So so if I start, like, let's say, an elimination diet, does
Yes.
that help? And like 6 weeks later, try again?
So that is helpful for food sensitivities.
Right.
So that's actually a very hot topic these days. A lot of people have digestive difficulties and troubles, bloating, abdominal pain.
Is that considered an allergy too?
So it's not actually. And it tends to be more with how you're digesting the food, right? It's not an immunologic response, which is like a food allergy. And the only testing that we really have, well, actually, there's no testing for food sensitivity. A lot of people are getting IgG testing, and you can pay a certain amount to do a panel of IgG tests to food, but those have not actually been validated. They've not been shown to diagnose anything. So let's say you got a food allergy panel test with IgG, and a lot of these things are positive, but you've never really had a reaction to them. The IgG, as opposed to IgE, will only tell you that you've had that food before. It doesn't tell you that you have a problem with it. It just tells you that it's been exposed, or you've been exposed to that food. So it's a gray area, and I think a lot of people are confused because there's a lot of information and availability for this testing these days. And in my opinion, the best thing to do if you have any question regarding food sensitivities, allergies, is to see a board-certified allergist immunologist.
That leads us to the Florida Center for
Yes.
Allergy and Asthma
Yes,
Care, and they can be
exactly.
reached at 1-877-877-4-ALLERGY for any other additional information. So
Yes.
this is a great way to start. So they reach out to you, and you're able to help
Yes.
navigate a plan that would work in their
Yes.
lifestyle and to
Yes,
help solve
of
this problem.
course. So, we like to take a detailed history of any food reactions, of any symptoms that are developed after eating a food, and we help to sort of discern what is a true allergy, what is a food sensitivity. And I think a lot of people, if they get allergy testing, and they find that they're not allergic to anything, they say, oh my gosh, well, I definitely don't feel good when I eat this food. And just because there's no test to prove that, I know that it's true. Everyone knows their body best. And what's most important is for a person to have a food diary, to notice which foods cause these symptoms.
So this food diary is after you've eaten or before you're eating something, you
Correct.
jot it down. So you're really
Yes.
mindful about what your
Yes,
intake is.
exactly. Because the patient has to do a little bit of sleuthing themselves. If it's not a true food allergy, the food sensitivities, there isn't a test for it. So you really have to do your own homework and see, what foods do I feel good with? What foods do I not feel good with? And avoid those ones that cause problems. Now, something like celiac disease is even different. So that is an immunologic response, but not an allergy. So
it is not an allergy. But what about gluten? Is gluten an allergy?
Gluten? You can be allergic to gluten or wheat in
Because
general.
it's such a hot topic. I'm gluten
Yes.
sensitive. It has to be
Yes.
gluten free.
Yes.
What is that about? Do you think
Yeah.
is that too much hype going on in the
I
food industry, or is
I
it
think-
valid?
I think it's valid. I mean, a lot of people just don't feel good when they're eating gluten. So in general, it's not an allergy. There are definitely people with wheat allergy. Particularly children are more prone to having something like this. And I've seen it many times before. But in terms of adults that previously have tolerated wheat, that feel better on a gluten-free diet, that tends to be more of a sensitivity. And again, I wish I had a test to confirm, because a lot of these patients really want something that they can say, okay, this is why I'm feeling this way. Now I'm getting that validation.
Absolutely. We are looking for answers as
Of course.
patients. And I know as doctors, you're trying to give us that.
Yes,
But
of course. And unfortunately, we don't have a test for that. But, we believe it, and we believe patients. So I hope that people will feel comfortable coming to the allergist with these dietary concerns, because we want to help weed through what's an allergy and might you need an EpiPen versus, a sensitivity.
Oh, EpiPen. Let's talk about the EpiPen. What
Yes.
is that good for?
So EpiPen is good for any serious allergic reaction. So certainly a food allergy if you're having anaphylaxis, but
Is it
you stick it in, not the arm, into the thigh. It's actually very easy, and it doesn't hurt too much. Speaking from personal experience, I've had to use it for my food allergies before. It's very easy to use, and there's actually a couple of different models of it now.
and
But
this isn't covered by insurance?
it is, yes. Thank goodness, because it's a life-saving medication for people that have food allergies or even other allergies. So, some people on allergy shots, for example, they might have anaphylaxis to the shots if they're sick that day, or there's something kind of underlying going on that may precipitate it. Then an EpiPen would be helpful for them.
And you get that by prescription from your office?
Yes, exactly. So I would send a prescription for it. The EpiPen will expire in a year, so you have to follow up with us because we want to make sure that you haven't used it. And then if you need a new prescription, we'll send another one for you. But essentially, epinephrine is the treatment for anaphylaxis. By far the first, a lot of people will say, oh, well, let me try some Benadryl, see how it goes. Take the epinephrine. There's no adverse effects aside from some heart racing. If you needed the epinephrine, it will work and do excellent. If you didn't really need it, but you took it, it's okay. It's okay. At least you're alive and well.
That's
right.
That's right.
Yes.
In the time that we have left,
Yes.
anything that you want to cover that I might have missed that you would like your audience to know about yourself?
Oh,
About Florida Center?
no. Well, I mean, I love working at Florida Center. We have so many different allergists and immunologists, and there's a personality for every type of patient too. So we love what we do. We are we're the largest center in South Florida, and I think that we provide really excellent care. And I hope that people will come see us to help figure out their allergies, because a lot of allergies may not be life-threatening, but they truly affect quality of life.
Absolutely.
And I know this, and you know this from personal
Absolutely.
experience, that waking up and having nasal congestion and not being able to breathe through your nose, especially with a mask on, it's really difficult, and it's hard to do what you need to do in your daily life if you can't breathe through your nose.
Absolutely.
So there's no need to suffer. Come see us and we'll make you feel better.
And they have so many locations in Kendall and Coral Gables and
Yes.
Palmetto Bay and Hialeah, Miami Beach, West Kendall, everything close by to take care of you and your health. Dr. Nassau, you
Yes.
have been a delight. I hope you come
Thank
back
you.
again, but there's so much more to talk about.
I would love to come back. This was fun.
She's a great doctor. I
you.
I would feel comfortable being her patient. And
Thank
I
you.
want to thank you all for coming and being part of today on the Community Voice. I'm Fara Sax. For your health, to your health, take care of yourself, be safe, and see you next time.